Medications are sometimes administered rectally through the anus for several reasons. 1. Avoidance of the digestive tract. Bypassing the stomach and intestines. Some medications can be irritating to the stomach lining, or may be broken down by stomach acid and digestive enzymes, reducing their effectiveness. Rectal administration allows the medication to bypass the digestive tract. 2. Rapid absorption. Quick onset of action. The rectum has a rich blood supply, allowing for quick absorption of the medication directly into the bloodstream. This can be particularly useful in emergencies or for medications that need to act quickly. 3. Avoidance of first-pass metabolism. Liver bypass. When medications are taken orally, they pass through the liver before reaching systemic circulation. This can lead to significant metabolism and reduction in drug concentration. Rectal administration partially bypasses the liver, increasing the bioavailability of some medications. Convenience and compliance. Rectal administration is useful for patients who cannot take medications orally due to vomiting, difficulty swallowing, or unconsciousness. Often used for pediatric patients who may have difficulty swallowing pills or are uncooperative with oral medications. Localized treatment. For conditions like hemorrhoids, inflammation, or pain in the rectal area, administering medication rectally allows for direct local treatment. Sustained release. Some rectal formulations are designed to release the medication slowly over time, providing prolonged therapeutic effects. Effectiveness. Rectal administration can be highly effective for certain medications and conditions. The rectal route provides a useful alternative to oral and intravenous routes, particularly when these are impractical or ineffective. Some common examples of rectally administered medications include Antiemetics for nausea and vomiting, Antipyretics for reducing fever, Analgesics for pain relief, Anticonvulsants for seizure control, and Laxatives for constipation relief. Examples of rectal medications. Suppositories are solid bullet-shaped doses that dissolve in the rectum. Enemas are liquid medications administered via a small tube. Foams and gels are used for local treatment of rectal conditions. In conclusion, rectal administration of medications offers several advantages, including rapid absorption, avoidance of digestive breakdown, and convenience in specific situations. It is a valuable method for delivering certain drugs effectively and efficiently.